This learning object is a production of Abu Dhabi Men's College, Center of Excellence for ICT and Learning Technology.
Today we're going to talk about the anatomy of the heart. I'm going to show you the different structures of the heart. I want you to imagine the heart as 4 chambers. I want you to imagine the heart is as one chamber divided into 4. The upper part of the heart, which we call the auricles or the atrium. I have 2. I have the left and the right. Left auricle, or left atrium and right atrium. The auricles are separated from the ventricles by valve. On the right side of the heart, I have tricuspid valve that separates between the right atrium and the right ventricle. On the left side of the heart, I have what I call the mitral or the bicuspid valve that separates the left atrium from the left ventricle. The valves are there to prevent the backflow of the blood during ventricular contraction. So basically, during ventricular contraction, the valves are supposed to close. Well, the atrium, the left and the right, are drained by different blood vessels. If you look at the right atrium, it's drained by the superior and inferior vena cava. The superior vena cava basically drains the upper side of the body, namely the head and the neck and the upper part of the chest. And the inferior vena cava brings blood from the lower part of the body, the abdomen, the lower extremities. These two, they bring blood to the right atrium. And from the right atrium, blood is going to be propelled under the effect of pressure difference and contraction of the right atrium into the right ventricle. And from the right ventricle, blood is going to be ejected or pumped through the pulmonary artery into the right and left lung for oxygenation to take place. Now, once oxygenation has taken place, blood has to go back to the heart to be pumped into the different body tissues. So basically, as I said, blood is pumped from the right ventricle through the pulmonary artery into the left and right lung. In the lungs, oxygenation is going to take place. Now, the blood is well oxygenated, it has to go back to the heart. The blood will go back to the heart through the 4 pulmonary veins. But now the blood is going to be drained into the left part of the heart, into the left atrium. Blood that is now oxygenated is draining into the left part of the heart, into the left atrium. From the left atrium through the mitral valve, that is the bicuspid valve, it will go down to the left ventricle. The left ventricle now would eject blood through the biggest artery in our body, which is the aorta, into the rest of the body. The aorta would supply the whole body, the brain, the chest, the abdomen, through different bifurcations and smaller arterioles. As I said, the left part of the heart is separated from the right part of the heart by what we call a septum. Between the left and right atrium, I have the intra-atrial septum. Between the left and right ventricle, I have the interventricular septum. As you can see, I can see these blood vessels. These are basically the coronary arteries. The coronary arteries are the first bifurcation of the aorta. The coronary arteries, namely the left main coronary artery and the right main coronary artery, supply the whole heart. These 2 coronary arteries are nourished or are branches of the aorta. I want you to keep in mind that these 2 coronary arteries are perfused during diastole, that is during the relaxation phase of the heart, because during systole because these blood vessels are embedded within the myocardial muscle, blood cannot perfuse through them during contraction. So basically, these are the only arteries that are perfused during diastole or during relaxation period of the heart. So in conclusion, the heart is a very vital structure in our body. And to keep healthy heart, you need to remember to eat healthy and exercise regularly. Thank you very much.